I'm able to walk around this entire place. I'm able to actually go hiking again.
Something Patrick Hutchins wasn't able to do without being in pain. The active life he was used to got put on hold after hurting his left knee walking in between his college classes 2 years ago.
I just kind of stumbled, finally fell, kind of did a roll because that was kind of the safest route to take at that time. Not realizing that when I hit the ground, this leg kind of whipped over and kind of slammed and hit the ground.
Patrick actually didn't realize how bad his knee was until a few days later.
I had a torn meniscus, and then later on I discovered that I sort of like gouged a lot of cartilage out of my knee.
Patrick was referred to OrthoArizona sports medicine specialist Dr. Shelden Martin. He took a look at the injury and determined Patrick was a good candidate for a cartilage transplant.
I was actually in my training in 2010 at OrthoArizona. We were one of the test centers for this, so it's just recently been FDA approved in the last few years.
When cartilage is damaged, whether through a sports injury or how Patrick hurt his knee, the body has a hard time healing this type of tissue on its own.
This particular procedure, called de novo cartilage transplant, is something that if they've failed non-operative treatments and they're an appropriate candidate for the procedure, you have to get them scheduled for the procedure because it's based on donors.
The healthy donor's cartilage, which is from someone who is 12 years of age or younger, is harvested, and when done, it's ready to be transplanted into the patient to help regenerate new tissue.
Typically, you'll start with an arthroscopic procedure and then convert to an open procedure depending on how big the lesion is and where it is in the knee. And then it involves removing some of the processing fluid on these cartilage wafers, and then mixing them up with a fibrin glue substance. And over about 15 minutes, that fibrin glue will become a hard gelatinous type substance, and you can actually pack that into the area of the lesion that you're going to be transplanting the cartilage into.
Martin had to repair Patrick's torn meniscus first, and after months of recovery, he performed the cartilage transplant in December 2015.
He had my leg in a brace so it wouldn't move. It was immobilized for a couple of months. Once that took place, once he took the brace off, unfortunately my tendons started to shorten up. And so I had to go back in for another procedure. And that's when he kind of scoped it to clean everything up.
Patrick went through rehab and was back to his active life, pain-free, last September.
We're still learning the best candidates for this procedure. But certainly our numbers are growing as we find more patients who are good candidates. It's technically an easier procedure to do than some of the prior cartilage transplant procedures.
Just to be a part of this and then for the results to turn out like they have, then I mean, I'm ecstatic about it.